Now, using our 3 steps, let's break this down. This question's asking for actions to be placed in order of completion. For the key problem, patient getting packed red blood cells or a blood transfusion, and the 30-minute assessment, the patient has increased temperature of 101 degrees Fahrenheit from 97.5, and also the patient has chills. So guys, we're immediately thinking, before we look, that the patient is having a blood reaction. So our solution is always, during a reaction, we stop what's infusing into the patient to stop the problem here. So, our options here. First, we always discontinue the blood right now that's causing the problem. Second, we dilute the body. We start that normal saline and keep the veins open, and we're just flushing that blood. Option 3, we're telling the primary care provider in this urgent scenario. And solution 4, or step 4, we get urine to assess that renal function for impairment if that reaction is happening. And 5th, we always document our findings and nursing actions in the patient's chart. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the actions that require correcting. For the key problem, nurse is caring for a patient that's being prepared for a liver biopsy. So, biggest thing we're thinking is teaching, assessment, clearance, and even signing a consent here. So the solutions we're looking for here are actions that would be inappropriate for this procedure. So we're looking for the wrong actions here. So option number 1 and 2 are incorrect here. So consents are always signed before procedures, and option 2, type and cross, should be done before the procedure. So guys, we're looking for the wrong answer, remember that. So option number 3, we have to choose, because coagulation studies need to be checked prior to the procedure for risk of bleeding. And option number 4, we have to throw out, because vital signs should be closely monitored during this procedure. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking about incorrect statements for the key problem that 18-year-old patient with an epi injection pen use. So, biggest thing we're thinking here, before we look at the options, are severe allergic reaction and then ejection device usage. So the biggest solution here, statements that are wrong about EpiPens and basically the medication administration for them. So, option number 1 is incorrect. Basically, the needle can be used to inject through the clothes in case of emergency. So, technically, we're looking for the wrong options here, guys. Option 2 and 3, inject the pen should be available at all times in case of allergic reaction. So, that's technically correct. Again, we're looking for the wrong one here. Option 3, injection should be in the thigh, in the IM, intramuscular, for best access. So option 4 and 5 we have to choose because they're incorrect here. So we still need to go to the ED even if the pen helped. And option 5, only for allergic reactions, not for any other type of breathing issue. So big anklet step, guys. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question is a knowledge-based question asking you to put the placement in order. So for the big problem, you're placing a peripheral IV catheter. Biggest thing you're thinking about is finding an IV site, the tourniquet, cleaning, securing, and confirming the placement. So the solution, we're looking for the proper steps to put a PIV inside the IV. So step 1, we always clean the site to prevent infection with those alcohol swabs, guys. Then step 2 is you apply the tourniquet and hold the skin taut to stabilize the IV. Make sure it's ready for access. Step number 3 is you insert the IV catheter with that bevel end up to allow for blood. And 4th, you continue advancing until blood flashes back to confirm placement of the IV. And 5 and 6. Number 5 is you remove the needle safely, attach the tubing. And then number 6 is you cover and secure with that IV dressing there. So really the biggest thing here is just remember to keep that beveled end up. That's really probably the biggest distractor. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question's asking when to tell a student to come back after the key problem, you administer a PPD test for TB. So anytime you're doing a PPD test, guys, write this down. You need to recheck it in 48 to 72 hours. So a solution we're looking for is that time frame, that window, 48 to 72. So option number 1 is incorrect, 12 hours is too soon. Option 2 and 3 are incorrect, 24 hours and 36. Guys, 48 to 72. So option number 4 and option number 5 are correct. That 48 to 72 hours. Now option 6 is incorrect. 96 hours is way too long. So please remember to write down those windows. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question's asking for placing in order the problem, teaching a patient how to correctly use an IS or incentive spirometer. So we're already thinking expanding the lungs, preventing atelectasis and pneumonia. So our solution here is correct steps for using an IS. So first step is option number 1. Patient should breathe out and empty those lungs. This allows for a bigger inhale. Second, we do option number 5. We place the lips firmly around the mouthpiece. Then 3, you take a deep breath in to level as ordered. So just make sure that level is correct. Then number 4, you hold it in for at least 2 to 3 seconds and expand those airways. And then 5, exhale slowly. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking about actions that need correcting. So we're looking for the wrong options here. For the key problem, watching the student perform trach care. So we're thinking already trach care as a sterile procedure, and we're thinking about airway and breathing. So solutions we're looking for are actions that are not right for this patient. So option number 1 is incorrect. Guys, it's proper to use clean gloves and removing those soiled dressings initially. Option 2 is incorrect because semi-Fowler's position is appropriate, not flat, for that aspiration risk. Remember, we're looking for the incorrect options here. So option number 3 is our correct option, guys. Sterile gloves are needed to clean the stoma when you're doing the cleaning. And option number 4 we have to skip because mask and goggles to prevent respiratory secretions in the face is technically appropriate. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the priority action of what to do first. For the key problem, you're preparing an order for 40 microequivalents of potassium IV for key term here, 15 minutes, guys. So don't worry about that the patient has potassium level of 2.9. Biggest thing you should be thinking right now is that's a high dose given very, very fast. So guys, remember P for potassium is P for priority, but also P for problems. So guys, 15 minutes is way too fast. We should be giving potassium over the course of an hour. So a solution that we're considering here is clarifying with the HCP or that provider. So option number 1, guys, it's incorrect. We have good access to an IV site, but this doesn't address the actual order itself. Option number 2, you technically can dilute potassium in D5W, but it doesn't change the order itself. And option number 3, we don't start an IV order without verification, so this option's incorrect. There's no indication of volume of potassium infusion. And option number 4 is correct, guys. We always check the order with the provider. Guys, potassium is priority here. We have to give potassium over an hour when it's given via IV. So, potassium given in 15 minutes is way too fast. Just confirm the order there. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for correct statement for the key problem, proper methods for a heel stick on a neonate or a newborn. So the biggest thing we're thinking is location on the heel, the lancis size, as well as prepping with warmth. So the right solution we're looking for is the right way to do a heel stick on a newborn. So option 1 and 2 are incorrect. Automatic lancets are fine, but guys, just check the size. And option 2, don't use the center of the heel. There may be nerves or bony prominences there. And option 3 is correct here. Warm the heel, which helps with blood flow. Just think vasodilation with warmth. And lastly, option number 4 is incorrect. A venous puncture can be used on a newborn, but guys, we're talking about a heel stick here. So remember, the right placement for the venous puncture is in the vein and really not in the heel for a heel stick. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for the incorrect action for the key problem, patient using and caring for hearing aids. So the first thing we're thinking is volume, cleaning, and positioning inside the ear. So the solution we're looking for are the actions that are incorrect. So option number 1, guys, we should not turn up the TV volume to drown out the background noise. The patient may need to have a volume adjustment here. So we have to choose that one. Option number 2, we also have to choose because we don't put hearing aids into water. We just wipe them down. They're technically not waterproof. And option 3, we have to skip because close off battery once the battery is put in place. And option number 4, we have to choose increasing the volume once it's inside the ear, guys, not before. And lastly, option number 5, we have to skip. We shouldn't blow dry the hair with the hearing aid in because the noise and the heat might hurt the patient. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking what to do next for a key problem, patient with an indwelling urinary catheter that says it's leaking around the insertion site. So guys, the biggest thing we're thinking about is the tube might be compressed. So solution is assessing the catheter tube here. So option number 1 is correct. Inspecting the tube for kinks and obstruction, assess the tube's functionality. So that's good. Option 2, 3, and 4 are incorrect. So guys, it's not appropriate to delegate to the charge nurse. Technically, if you're the nurse, it's your responsibility. Option 2, we don't DC or discontinue or swap out for a bigger size without assessing first. And option 4, assess the catheter before adding more fluid to the balloon. Guys, you don't even know what the problem is. So always assess the patient and that machine together. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for the most appropriate action for the key problem. Patient has an order for 10 units of regular insulin and 10 units of NPH. be given for that hyperglycemia. So guys, before we look at the options, you're already thinking clear before cloudy. You want regular days before that cloudy NPH. So solution here is preparing insulin per order. So option number 1 and 2 are incorrect. Where administering only regular insulin is not following the doctor's orders. We administer both of them. Option number 2, patient has high blood glucose. Doesn't need carbs, they need insulin here. Option 3 is correct here. Regular before NPH when you're drawing it up. So memory trick again, clear days before cloudy days. We want regular insulin before that cloudy NPH. And option number 4, administer only NPH insulin. Guys, incorrect. You need to administer both of them. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. So this question's asking for the correct placement of the stethoscope for the key problem, a heart murmur with a patient with aortic stenosis. So the biggest thing we should be thinking about is we're putting that stethoscope near the aortic valve. So the memory trick for the aortic valve, the solution we're looking for, is all pigs eat too much, or apetum. So aortic, pulmonic, tricuspid, Erb's point, and then the maximus impulse. So guys, aortic is right over here on the right side. So option number 1 is incorrect. It says the second intercostal space on the left side, guys. We're doing the right side here. So option 2 is correct. Second intercostal space from the collarbone. So we're doing 2 ribs down, sternal border, aortic valve right here. Remember, all pigs eat too much. A for aortic valve. Now option 3 and 4 are incorrect. The third intercostal space on the left, no for option 3. And option 4, the fifth intercostal space, mid-clavicular. Guys, that's really far from the aortic valve. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. So this question's asking which steps do we place in order? For the key problem, suctioning in a patient with a trach. So the first thing we're thinking is surgical asepsis and airway protection. So the solution we're looking for here, guys, proper way to do this procedure, suctioning in that trach. So first is option number 4. We position the head of the bed up to assist with access and decrease the risk of aspiration. Second, we give the patient extra oxygen to compensate for suctioning. Third, we insert the catheter into the trachea. And fourth, once resistance is felt or patient's cough, we basically stop. And lastly, number 5, we begin intermittent suctioning while twisting the catheter on the way out. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question's asking the priority action or what to do right now. So the problem here is that the patient becomes suddenly short of breath, moving around in bed during a centralized tubing change. So the biggest thing we're thinking before we look at the options here is an air embolism. So guys, the solution we're looking for is something that addresses the problem to prevent the worst possible outcome. So option number 1 is correct. Circulation and ventilation are the most important because the patient needs O2. Option 2, 3, and 4 are incorrect, guys. Positioning the patient on the left side if the embolus is suspected here. Option 3 is good to notify, but guys, we don't need to address the problem, address the patient right now. And lastly, option 4, breathing treatment is not appropriate for an embolus. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for the appropriate actions for the key problem of prepping to administer several non-extended release medications through this feeding tube. So just think, we have to crush, so the right medication should probably be liquid. So the solution we're looking for are right ways to give these medications. Now for the options, option number 1 and 2 are incorrect. So option number 1, guys, we can crush all the meds, but they should be done separately and not in the same container. And option number 2, meds are given one at a time through the feeding tube, guys, not all in the same bag here. And option 3 and 4 are correct. Liquid, easy to use forms are given through via tube. And option number 4, guys, we're checking all meds and giving all meds one by one, not all together here. And option number 5 is incorrect. Feeding tubes are not connected to suctions after medications are given. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for a priority action of what to do first. For the key problem, you're assessing a patient with an NG tube who's getting continuous feedings. But now the marked indicating placement is much lower than before. So guys, the biggest thing we're thinking about right now is that that tube probably got dislodged and now filling up the lungs. So we need to confirm placement, but before we do that, we should stop anything infusing into the patient. So the solution we're looking for is ensuring we're stopping the feeding here. That's the biggest thing to prevent the worst possible outcome here. So option number 1 is correct. Guys, we're stopping the feeding to ensure that no food is going into the lungs. That would be aspiration and potential pneumonia. Option number 2 is incorrect. We can confirm where the tube is, but guys, stop it first before worst possible outcomes here. Option 3 is incorrect. Checking placement is good, but always stop the machine that's causing the problem. And option number 4, we may need to remove altogether, but again, we need to stop the machine first. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking the priority action, or what to do right now. So the problem here is that the patient becomes suddenly short of breath, moving around in bed during a centralized tubing change. So the biggest thing we're thinking before we look at the Now, using our 3 steps, let's break this down. This question's asking about the nurse's response to the key problem, the patient care tech that tells the nurse during CPR that another patient wants nausea medication. So guys, the first thing I'm thinking, if you're doing CPR on a patient and one of your techs comes in, basic thing is just to basically reroute them somewhere else. So obviously you need someone else to give that medication. So the solution, address the patient's needs with someone else. So option number 1 and 2 are incorrect. The patient complaining isn't about pain, guys, and the PCT cannot technically assess that. Option 2, the PCT can't give medications. So option number 3 is the correct option. Notify another nurse to assist the patient, because the current nurse is obviously doing CPR in that emergency situation. And option number 4 is incorrect. Giving an Emerson basin doesn't really help with the nausea. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for statements that need exploring, or basically further assessment. For the key problem, patient that states something before going to MRI contrast. So we're looking for contraindications for an MRI. So memory trick we use is MRI, think magnet. So the solution is we're looking for statements that might prohibit the patient from this magnetic procedure. So option number 1 is correct. Guys, we need way more info if the patient has pins or metal inside their ankle. This would be contraindicated for that MRI, that magnet there. And option 2 and 3 are okay. Piercing should be taken out. And option 3, smoking an hour ago is not contraindicated for an MRI. Now option number 4 and 5 we have to choose, because if a patient broke out in hives due to the dye, this might indicate an allergy, so exploring further for option 4. And lastly, option number 5 we have to choose as well, because a late cycle may indicate pregnancy. So we can't have that patient go to MRI with that contrast. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question is asking for the incorrect action for the key problem, the new grad given an IM injection to a newborn. So immediately we're thinking needle size and location here. So solution we're looking for are the wrong actions for giving an IM injection to this newborn patient. So option number 1 we have to choose, because the deltoid is not used for IM for newborns. We use the thigh, known as the vastus lateralis. And option 2 and 3 we have to skip, because aseptic technique should be used for an injection. And option 3, a small tuberculosis syringe is okay volume for injecting if the patient is small. And option 4 we have to skip, because it's a small gauge for needles should be used with that newborn patient. Okay, that wraps it up. For more details and test tips, please see the rationale below.